And we have talked about somehow the implications of these new insights for treatment of these disorders. But by far, the most interesting insights from the study of non-ordinary states are related to the most serious disorders, the most serious conditions that we refer to in traditional psychiatry as psychotic. This is a very mysterious category of disorders for which we really don't have any adequate explanation. These disorders usually lead to psychiatric hospitalization, sometimes for many years. According to some statistics, every other bed in the United States is occupied by a psychotic patient. So those are chronic conditions very frequently that require decades of treatment, mostly by pharmacological agents. And they also lead to lifetime labels for these patients. Even if they are not involved in long-term hospitalization, they carry the label as a result of some episode that they had in the past. In current psychiatry, we have two different approaches to the understanding of these conditions. And I should emphasize that we'll be talking about disorders which are called functional. There is a significant subcategory of these psychotic disorders where we know actually the medical background, the causes of these disorders, and those are called organic. For example, states that can be explained as a result of degeneration in the cerebral cortex or some vascular disorders or infections and so on, tumors. Those will be referred to as organic psychosis. So we'll be now looking at those where basically we don't have any medical findings that would account for these disorders. And we have two different approaches. Really, a minority of psychiatrists are trying to give some psychological interpretations of these states. And the current mainstream psychological theory is limited to postnatal biographies. So in this context, there are attempts to understand functional psychosis as regression to a very early oral period of the libidinal development in the Freudian sense, and also disturbances of the relationship between the child and the mother, this very, very early stage of life. Now, this is not a very convincing explanation because it doesn't account for some very, very significant aspects of these states. For example, some extremely intense emotions that we find in psychotic patients. For example, paralyzing terror or profound despair, consuming guilt, murderous aggression. It also doesn't explain the extremely rich and complex spectrum of the experiences that these patients are having. For example, experiences of death and rebirth, experiences of destruction and recreation of the world, encounter with various mythological beings like demons and deities, past life experiences which take these patients to other centuries, other countries, very intricate metaphysical speculations that these patients often have, and experiences of mystical states, cosmic unity, oneness with the universe. So both the intensity of the emotions and also this rich, unusual content of these experiences is very, very difficult to relate to a situation of a hungry or a lonely infant, some of the disturbances during this early oral period. For this reason, most of traditional psychiatrists see these conditions as organic, caused by some kind of unknown brain pathology or maybe pathology in other parts of the body that indirectly influence the brain. So the idea here is that although we don't know any kind of organic explanation at this time, if we continue our research, that sometime in the future we'll be able to explain them as medical problems. Now again, even here, it's very, very implausible to imagine that some kind of biochemical process or some physiological process could influence the brain and create these extremely complex stories and visions and metaphysical speculations that we find in these patients. So in a way, neither the psychological interpretations available in traditional psychiatry nor the assumption that some kind of unknown pathological process of a biological nature is involved give us very convincing and very satisfactory explanations for these conditions that we call psychotic. If we now apply the insights from the study of non-ordinary states, we get some completely new possibilities in both understanding and treating these disorders. We talked earlier about this large cartography of the psyche that emerged out of this work, where we don't have just postnatal biography, but we have the perinatal dimension, and we have this vast dimension that we now call transpersonal. Now, from this perspective, the content of the so-called psychotic experience is actually drawn from the psyche as such. Of course, psyche is understood in a much, much larger context, in the sense of the Jungian anima mundi, for example. So when we have a conceptual framework that includes birth, the trauma of birth, we can understand some of the powerful emotions that I was talking about. Tremendous fear of death, the sense that the whole world is being destroyed, powerful feelings of aggression and so on, but also the rich content of these experiences, which can be coming from the collective unconscious, both in the historical sense and the archetypal sense. So in this kind of new understanding, the problem is not to explain the content of these experiences that simply is coming from the psyche as such. What we have to explain somehow is actually the trigger, which is why for certain people the deeper dimensions, the deeper levels of the unconscious emerged without any known reason in the middle of everyday life, whereas other people have to take a catalyzing drug like LSD, or have to do half an hour of faster breathing, as it is in the holotropic breathwork, or have to participate in a shamanic ritual. So basically, when we work with the holotropic breathwork, we see daily the kinds of experiences that these patients experience as part of their episodes. For example, we very frequently see people reliving birth, having experiences of psychospiritual death rebirth, having past life experiences, having archetypal experiences. And this happens to a group of people who are not normally considered to be psychiatric patients. They're people who come to workshops or people in our training. So at a certain point it became very difficult for us to see these states as being states of serious psychopathology if the same kind of experiences can be induced by something as simple as accelerated breathing and music and a certain kind of body work. So we coined for these states the name spiritual emergency or psychospiritual crisis. That term spiritual emergency is a play on words. There's a certain sort of ambiguity in that term. Emergency in English means crisis. We talk about a medical emergency, about the emergency room and so on. But the original Latin word emergere means emerging. So the term also indicates the possibility of rising somehow to a higher level of understanding or a higher level of functioning. So we talk about spiritual emergence and spiritual emergency. Now this has very profound implications for therapy, because as we talked about it earlier, the manifestation of the symptoms in these states would be seen basically as an attempt of the organism at healing, at transformation, spiritual opening, very much in the sense of the Jungian individuation process. So if we have this kind of understanding, the last thing that we would do would be to use some kind of method of suppressing the symptoms. We would want to draw the symptoms out. We would encourage the patients to fully experience what is emerging, sort of guiding them somehow to the resolution and integration of these states. Now, the people who are in these states, they need different degrees of care. One of the major problems that these people have is the fact that in our culture and in current psychiatry, these states are seen as pathological, as manifestations of mental disease. So these people who have these states would feel isolated, frightened, they have a fear of insanity and so on. So if this is a milder form, what is frequently enough is just contact with a person who has a deeper understanding, who is willing to listen, give people encouragement and support.